Now I would like to introduce our speaker for today, Pharmacist Amy Tran. Amy is a practicing pharmacist in Sydney and Victoria. She believes in the value and potential of having a pharmacist knowledgeable in Parkinson's disease on the healthcare team. Amy sees great importance in educating the community about medications because she understands the challenges that one may encounter between appointments. Engaging in a manner that empowers individuals to believe in their own ability to manage the medications and to get the most out of their treatment is always her goal. Please join me in welcoming Amy.
Hello, everyone. Thank you, Amy, so much for that introduction. It's great to be here today to chat with all of you and do a webinar on just questions and answers about Parkinson's medications, because I do get them a lot, both through just working out in the community and just over email as well. So I thought it was really good that we could do this together today. So before I start, I'd just like to just put out this disclaimer that there are certain specific questions that I will not be able to answer because I won't have sufficient background information or your medication history to make a proper recommendation. I will address today some commonly asked questions based on my training and my personal experience with clients that have Parkinson's disease. And I will always emphasize and stress the importance of communicating with your healthcare team about specific questions regarding your health and well-being. So throughout this presentation, I will be using different abbreviations throughout the slides. So of course, Parkinson's disease will be abbreviated as PD, levodopa, carbidopa will be abbreviated as levocarb, immediate release as IR, and controlled release SCR. So I can see some of the questions now, and I will definitely be addressing some of those for sure, actually both of those. So going forward. So one of the most obviously common questions is, when do I start taking medication? This is a very common one. And of course, I will always say that it's best to be discussed with your neurologist, to discuss with them what's the best approach going forward based on your symptoms, based on your patient history, based on any test results, etc. In some cases, I have met individuals who were given a prescription and also told to start the medication when they wish to, hence this question. Some individuals will take the prescription, they'll want to think about it, do some research. Of course, they'll have some concerns, they'll have questions about side effects. So I thought it was important to address this, and I will be doing it over multiple slides just to show you my thought process. So some individuals very early on in the disease may choose not to start medication therapy. So if their symptoms are very mild, that may be a reason why they choose not to start. However, I will always ask these individuals to consider and just ask themselves, can they still do the things that they need to do around the house with ease? Can they prep a meal? Can they get ready in the morning comfortably, brushing their hair, brushing their teeth, chopping vegetables? Can they do their errands with ease without experiencing any rigidity or slowness? Another important thing I'll ask is, can you exercise at your maximal capacity without medication? Can you exercise essentially effectively? And I put physiotherapy because I think they are such an excellent resource to just, even if you just consult with them, to see if they can do possibly a detailed assessment with you, to see what, things that may need to be improved on, things that are doing well. They could possibly create an exercise program that is best for your needs, just to ensure that you are able to exercise to the best of your ability without feeling that you're being hindered. So I always recommend to just see what's available in your community at this time. I know with the current health climate, a lot of it is done over Zoom. So it's always good to reach out and see how they're addressing it and how they are seeing patients, whether it be over an online basis or in person, but just very limited. Also, of course, with Parkinson Society BC, an excellent resource too, if you wanted to see if you can connect with someone, they might have some recommendations for sure. So the next thing there is another question or statement I'll get a lot of time regarding when to start medication is someone will tell me, I was recently diagnosed with Parkinson's disease and have started on levocarb. My only symptom is a tremor in my non-dominant hand. For some people, it might be their dominant hand as well, right? But just for this example, I put non-dominant. And for this individual, they're experiencing no difficulties that affect their day-to-day functioning. Should I stop taking levocarb or decrease my dose? So, of course, for this one, we never want to just stop taking our medication abruptly. In this case, I would say speak to your neurologist if possible, but I know sometimes that's not feasible, right? Because you see them maybe every 6 to 9 months, maybe a little bit longer than that. So in that case, just even if you can speak to your family physician based on just your relationship with them, like some people have had family doctors for many years and they find that it's easier for them to touch base with their family doctor versus a neurologist. For some people, it might be a nurse practitioner, depending on their skill set and what they feel comfortable. For a lot of people, they may have been recently diagnosed and their starting dose is 1 tablet 3 times a day of the levodopa carbidopa 100 over 25. And some will note that they don't really notice a difference. So in other words, one may find that they don't feel better or worse in between doses. So I can definitely see why this question comes up. That's why I will always say, why don't you speak to someone that might have some history, better, thorough, full picture of you and your health status. But with this question, I would like to address that this question may also come to mind for some individuals because of this next thought. And it's the thought that some people want to save their medication for when they really need it later on. Saving medication when symptoms start to become more bothersome than they are now, essentially, right? The thing is with that, there is no good evidence that says we can or one can save the best response for later. With Parkinson's being progressive in nature, how you respond later in time to levodopa may be different than how you respond to the medication now. I have mentioned this before in a past presentation on levodopa. As Parkinson's progresses, our response to levodopa can change. So you may find that it goes from a long-lasting and stable response, which means that, say, for example, if you're on the regimen of 1 tablet 3 times a day of the levodopa carbidopa 100 over 25, where you can take 1 tablet every 6 to 8 hours, generally consistent, no issues in regards to your mobility, the speed at which you're able to do the things that you need to do, you're not feeling rigid or stiff, you're having that effect throughout the day. But as time passes, years down the road, you might find that how long your medication lasts becomes progressively shorter and the response might be more erratic. So say, for example, if you were finding it that if you're taking a medication, it was lasting, 5 to 6 hours before, 4 to 5. And then as time passes, you find that after 3 to 4 hours, you might find that you'll need another dose. So just the levodopa, the effects of the medication doesn't last as long. But of course, I'll touch base on that later on things, how we can mitigate that and how we treat it rather. So overall, by delaying or putting off treatment now as it's been described by other healthcare professionals as well, as that if you were possibly delaying or putting off treatment, it might be more of a lost opportunity because of what I just said. How you respond rather now to levodopa may be different than how you might respond later. And in addition, things to consider with delaying treatment is, especially if you're experiencing bothersome symptoms, it may increase if you're experiencing bothersome symptoms, just if you're feeling any type of feeling unsteadiness on your feet, if you feel like you're more of a shuffling gait, if you feel like you're not feeling steady, essentially just your increased risk of having a fall, right? So you have to think about how other parts of your life will be affected if you do delay treatment. So the last part of this question is when you should start considering starting medication. So of course, highlighting it again, it's exercise, exercise, exercise. If you cannot exercise at your maximal capacity, if you feel like you need to take medication to maybe get more from your workout or exercise more effectively, definitely, a good idea to start medication. Or if your symptoms is affecting your ability to perform your daily activities, like getting ready for the day, prepping a meal, gardening, things like that, and just your overall quality of life, right? So your ability to work, your ability to engage in the hobbies and the things that you like to do, whether it be, sewing, knitting, gardening, arts and crafts, or just your ability to spend time with your family and friends. I know just during this time, very limited because of the current health climate, but just if you find that you're having to cancel, times to get together with your children or maybe grandchildren, if you start having to give certain things up due to your symptoms, definitely maybe you should consider starting medications. And with that being said, with Parkinson's disease and the medications used to treat Parkinson's, they don't stop working or become less effective. Instead, they may need to just be adjusted over time. So I see some questions here, and I think the best way to go forward, Amy, if you agree, is I think that we can go with, let's see here. I think I just answered. Does anyone have any questions? The pros and cons of starting medication early versus waiting, especially if present symptoms are not severe. So does anyone have any questions about what I just said regarding starting medications there? Okay, so doesn't look like anyone is saying anything. So I will go on to the next one. I am confused as what time of the day to take levocarb with regards to when I eat and what I should avoid eating. So I have some slides on that. Let me just click through it here because I have one about side effects, and that should be okay. So I know with this one, it'll tie into my next slide as well. But sometimes when people are started on levodopa, carbidopa, they will be advised to take it with food. And often we will find that it's due to the nausea side effect that they might get those instructions. So they'll be recommended to take it with food or with a meal, but it is best absorbed on an empty stomach if possible. And generally with side effects, they should go away. Your body should build up a tolerance to the side effects. In some cases, people do not. And that's when, time to talk to a doctor about maybe possibly adding on that medication, also known as domperidone. I actually have another slide. Excuse me. So this is one. So to answer this one, best time of day, best thing for spacing, usually with the levodopa, carbidopa, is I usually recommend that people take their levodopa on an empty stomach. So take it half an hour to an hour before you eat, and take levodopa 1 to 2 hours after a meal. As I just said, sometimes people are starting or initialized on taking levodopa with some food just to help build up a tolerance. The thing with taking it with food, it may reduce the absorption right? But with that being said, for some people, they have told me that they've been instructed to take it with a meal by their doctor. And I've asked them, is your medication working well? Do you find that your medication takes a little bit longer to kick in when you take it with food? What I mean by kicking in is usually with levodopa, especially with the immediate release formulation, people will tell me that within half an hour to an hour, their medication starts working. They can do things more with more ease. They're not feeling so stiff and rigid. They're not feeling slow, right? So if taking it with food does not cause a delayed or kind of slower onset or of the medication, then you can continue doing so, but monitor for any changes into the management of your PD symptoms, right? So yeah, generally, yes, I recommend to space because you don't want it to affect the absorption of your medication, how long it takes to kick in. And then the next slide, I think, what should I avoid eating? So of course, it's the spacing with protein that some people will hear from time to time, right? So the thing with protein is protein can block the absorption of levodopa, thus decreasing its effectiveness. So essentially, protein and levodopa are absorbed at the same site in the body, right? So if levodopa is taken with protein, they are essentially competing against each other to be absorbed. So it's best to take it on an empty stomach, your levodopa, to help facilitate absorption and avoid competition with the dietary protein, so the protein that you're consuming through your food. For some individuals, everyone will have a different experience with protein intake and levodopa. So for some individuals, they will find that they can take their levodopa not half an hour before their meal, but an hour before, like a turkey sandwich at lunch. And they can find that it actually affects how long their medication or their levodopa takes to kick in. Whereas some other people will find that levodopa that took it, like they took an hour before their sandwich, no issues. Onset is the same. So it really depends on the individual. From time to time, people will ask me about, how about a little bit of cream or milk in their coffee? And I think that should be okay. In regards to resources on what you should be eating, what you should not be eating, I think it's more of spacing, not that we have to avoid certain food groups. Does anyone have any questions to that?
Amy, thank you for that answer. That was really helpful. I think one of the questions that I'm seeing that kind of relates to what you just spoke about is about experimenting with the timing of their levodopa dosages. Are there any issues with experimenting?
I think there is no issues with experimenting at all. I actually have a slide on that as well. Let me just go to this slide right here. So often, here, I'll actually go to this one. So for people that have been adjusting or experimenting with their medications, I just honestly I think it's best to just document what type of adjustments you have been making and your response to these changes. So I think it's really good to just write it down, because then I like writing it down and actually writing the date, because then you can see what happened on this day. What did you do? What time did you take your levodopa, carbidopa? What worked and what didn't work when you did it that day, where you switched it around this time and moved your turkey sandwich to over here or moved your yogurt to over there? What happened when you had a little bit of peanut butter on toast? Because I do know from talking to individuals, they know there's certain things they cannot eat too close to their levodopa. I've had people saying, like, that a chicken sandwich, a turkey sandwich, a steak, like it was not a good idea. And they just had to be mindful of how much there's space. So as long as you document what works and what doesn't work, and just telling your healthcare provider at your next appointment on what you have tried and what you haven't tried, especially with what we're going through right now. A lot of the appointments, they're either, just months down the road, or they're over, the phone. a video call. So I think the main thing is just documenting what you're doing, just because it is a snapshot in time, right? As well as just communicating when you can what changes you have made. Does that answer the question? I know with everyone's comfort level, it's different, right? Some people feel comfortable adjusting. Some people, they need a little bit of guidance, and that's not a problem at all, because for some people, the case where they would like to adjust their medication, I think it's just best to talk to your healthcare providers, especially when you're unsure on how to go about it, just for their advice and guidance on how to proceed. At the end of this presentation, I have just kind of information. If for those who may have missed it, I did some presentations with PSBC about, that focused on levodopa. There's one that was focused on other medications used in Parkinson's, like the dopamine agonist, the MAO-B inhibitors, something like entacapone, amantadine. So there's a presentation on that. I have one on medication management where I go through, the different medication classes briefly, and then go onto just tips on how to go about managing your medications, and as well as some sample cases, which I'll just show how to get to at the end of this presentation, as well as a presentation on sleep, because sleep is a non-motor symptom that a lot of people may find they have an issue with. So I'll show that more at the end of the slide. But essentially, just if you like to adjust, just seeking guidance, just because questions like this do come up, right? My neurologist instructed me to take my medication at this time, and this time. I have been moving, or can I move the time to an earlier or later for the designated dose? It might be a 2 p.m., it might be an 8:30 dose. Or for some people, they might have the question of, I won't be seeing my neurologist for another X months, but I have been or would like to adjust my medication, right? So that's why I have the slide of, in the case of you're adjusting it on your own, it's just documentation and communicating with your healthcare providers what you've done. Or if you need help, then just reaching out for help to see if you can get some support and guidance on how to do so. Because sometimes, depending on your comfort level, some people, if they've had, Parkinson's for many years, they've adjusted just to see how they do. But then, of course, they might need help, right? So always reach out if you need assistance, because I know it can be quite tricky. Does that answer the question? Okay.
I think so. That was really helpful, Amy. Just tying back to your last question that you answered in regards to the pros and cons question, someone is just seeking some clarification here. Did they understand correctly that delaying can affect the response?
So in regards to the delaying, let me just get back to this slide here. I think, no, sorry. So exactly. So in regards to delaying, it's just as time passes, right? Because Parkinson's disease is progressive in nature, right? As time goes on, we start losing the neurons that are responsible for, storing dopamine, reusing and buffering dopamine, right? So how you respond to levodopa now may be different than how you might respond to the medication later. So that's why it's one of those things that if you are already experiencing symptoms of Parkinson's disease, but you're thinking about saving the medication for when it's, later when your symptoms get worse, you can't really guarantee that you're going to respond to medication in the same way. Like, you can't cash in the effects of the medication later on, if that makes sense. Like, there's no good evidence to say that you can actually do that with the medication because of the complexities of Parkinson's itself. Like, things change over time. And with that being said, right, everyone is so different in how their disease progresses, right? Like, for some people, they may have read about levodopa, for example, causing dyskinesia, right? And it happens after, for example, a few years, like 4 to 5 years after being on it. For some people, it might not be 4 to 5 years. It might be between 5 to 10 years. And there might be a small amount of people that don't have that levodopa induced dyskinesia. Like everyone's experience is different. So the thought of possibly delaying or putting off treatment, there's really no guarantee on how you're going to respond, right? So I think that it's best to use medication now if it allows you to exercise effectively, if it gives you that quality of life, if you can engage in the things that you need to do at a good rate, a good pace, you're not feeling slow and rigid, because it really comes down to just your overall quality of life now. And just hoping that you can resume that going forward with the levodopa, as well as other medications. Does that answer the question?
Thank you. I think it does. And it looks like we do have lots of questions today, which is really great. So if it's okay with you, Amy, we can start going through some of the questions that have come in.
Okay.
One that I see here is, what is the benefit of a dopamine agonist as opposed to levodopa?
So between dopamine agonists and levodopa, so usually with levodopa, it's the gold standard, right? It's one of the most effective medications for Parkinson's disease. In the past, what they did with the dopamine agonist is they would try to get patients started, on the dopamine agonist in hopes of saving the levodopa for later because of the side effects associated with levodopa, like the motor complications of dyskinesia or the motor fluctuations, right? So the dyskinesia, if you think of the kind of the irregular, uncontrollable movements in the realm of dyskinesia, the dystonia, where those spasms and those contractions making you feel stiff, and they can be quite painful. And then you think of motor complications also consisting of the motor fluctuations. So the wearing off, where your medication, a few years down the line, more than that, it doesn't last as long as it used to. So it was just those side effects where they would find that, why don't we try to save the levodopa for later by starting with a dopamine agonist? But now the evidence for that, it's pretty much conflicting evidence now. Like there's really uncertainty if you can really save if that actually really works, or just the evidence goes against that now, right? After more research, like now we're thinking about the pros and cons of delaying levodopa for later, and possible the complications that may arise from saving levodopa for later. So now, even for young onset, maybe starting with levodopa. So of course, there's things that still need to be looked into, but that's with the dopamine agonist. With the dopamine agonist as well, even if you are started on a dopamine agonist, you can still possibly have those adverse effects. So let me just get to the dopamine agonist. I think one of their things is the side effects that are associated with them. So just the drowsiness that people have read, the onset of sleep, the sleep attacks, and the impulsive control disorder. So generally with a dopamine agonist, it's just their side effect profile may not be as favorable, but it's one of those things where dopamine agonists are associated with fewer motor complications than levodopa for maybe the first 5 years of the disease. But with that being said, it doesn't completely prevent the development of levodopa related motor complications later on, right? So essentially, motor complications might occur earlier with levodopa, but like I said, some people might not get them for years. Some people might not get them at all. So it's essentially a lower risk of developing motor complications with dopamine versus levodopa. But then we have to think about the side effect profile of the dopamine agonist, like I said, about the impulse control disorders, the sleep attacks, which, they can be, I wouldn't say rare, because side effects, they can happen to some and not to others, right? So it's just one of those things where we have to monitor for adverse effects, right? So obviously in the case of someone's taking a dopamine agonist, their dose might be brought up or increased over time, over in a slow fashion, just slowly, so people can build up a tolerance and then increased. But the moment adverse effects come up where they're affecting their quality of life, in that case, like for example, sleep, or if, impulse control disorders, patients may either, their dose would be decreased or they would be slowly decreased and discontinued altogether, right? So it really depends. So the benefits of dopamine agonists as opposed to levodopa, I would think of it more as, honestly, it's a conversation to have with your neurologist. But, like I said, levodopa is your gold standard. It's the most effective medications for Parkinson's disease. And as time passed, I think the usage of using dopamine agonists first to kind of save the response of levodopa for later on the disease, I think that outlook is changing, as it's not as black and white anymore. And now they're kind of seeing and just looking into just the pros and cons down the road. It's definitely something that is being looked into, though. Does that answer the question?
Okay, thank you. I think it does. The person who asked that question, if that wasn't clear, you can let us know in the chat. We do have a few questions here about interactions with Cinemet. So one of the questions is there any interaction between vitamin B12 and Cinemet?
I haven't seen any interactions with vitamin B12 and Cinemet. In that case, I would definitely have to do a drug interaction just to be absolutely sure. But generally, I haven't seen, from my experience, with any multivitamins that may interact. I think the best person to ask is honestly your pharmacist, just to absolutely confirm any medications. Any time you're taking an over-the-counter medication, natural health product, definitely ask your pharmacist, because at the pharmacy, we do have the tools and resources to, make sure that there's nothing of concern to discuss. But from my experience, I haven't seen any issues with vitamin B12 and levodopa. But definitely confirm at the pharmacy, it doesn't hurt.
Okay, we had another similar question about calcium, magnesium, I believe. So would you say the same thing, just to go and check in with the person's pharmacist?
Yeah, I think definitely with just any type of over-the-counter natural health product, it doesn't hurt at all, just to confirm. Sometimes with these interactions, they can either be an interaction where, I'm talking about any medication in general, where it can actually either affect the absorption, or in some cases, some of these supplements, right, they might have a side effect. For example, calcium can be constipating, for example, right? So if you're already experiencing constipation, it would be something that you want to be aware of, because of course that might be making it worse. And then in regards to the magnesium, usually with the magnesium supplementation, generally with just my patients, or when people come into the pharmacy asking about magnesium, I always ask, like, was this a recommendation by your doctor? Did your doctor recommend magnesium supplementation? Because of course, having too high of magnesium levels in the body and having too low, like, that wouldn't be good either. So I always ask about that. But with the magnesium as well, like, magnesium can actually kind of offset the constipation, because a side effect of magnesium can actually be diarrhea. So if you think of milk as magnesia, for example, right? And what it does. So it's one of those things where you have to think about the different types of interactions that supplementation can have on just you overall, as well as the possible interactions with levodopa. Does that make sense? And
Yeah, it does. That's great. Thank you. We did get a couple of questions about interaction between taking levodopa and having beer or wine.
so I think for this one, obviously you don't want to overdo it, right? I think, of course, moderation is key. Of course, if someone is telling me, because, with the levodopa as well, it's one of those things. If someone is telling me they're feeling lightheadedness, dizziness, right? Because that is a possible side effect. And, low blood pressure is a possible side effect of the medication, as well as just Parkinson's disease, right? So anytime someone tells me dizziness, lightheadedness, obviously you want to be very mindful of your intake of alcohol with your levodopa. Of course, that's why if you are having a glass of wine, for example, with dinner, hopefully at that point you've had your levodopa maybe an hour before your meal, you're feeling not dizzy, you're feeling okay, you're not feeling drowsy, then of course you can have a glass of wine. But of course, just being mindful that you just keep your moderate. It's always about moderation. Does that help at all?
Yeah, it does. Thank you. Okay, and we have another question here. Does a liquid dose, I think of levodopa is what they're speaking about. Does a liquid dose of levodopa have the same effect as a regular immediate release pill dose?
I would have to ask, is this individual getting levodopa compounded? I would have to know, because just from my exposure in the community, we've had tablet formulation. Of course, there's different generic companies where they'll make like a controlled release or immediate release. Unless this individual is getting compounded levodopa in a liquid form, or maybe having a compounded form of levodopa carbidopa encapsulated at a compounding pharmacy. But I feel like if it is an immediate release formulation, I feel like it would work in the same way. But then again, I'm not quite sure. I haven't been exposed to liquid levodopa in the community, just from my personal experience in the pharmacy. So it's really hard to say. No, just regular tablet in the population. Yeah, I've just seen the regular tablet in the community, but the main thing is immediate release. Obviously, when you take an immediate release tablet of levodopa carbidopa, you're going to get an immediate release. So you're going to get kind of just all the medication released into like the bloodstream, right? Because with the immediate release formulation of levodopa, it has a bioavailability of 100%. So what I mean by that is your body can essentially use 100% of that medication. 100% of it gets into the bloodstream and it goes to where it needs to go. Whereas we can talk about controlled release if anyone has a question about that. But does anyone have a question? I think we can move forward, or what do you think would be best? I could see a lot of questions here, so I don't want to go off tangent if it's not of interest.
Yeah, you're right. We do have a lot of questions. So if it's okay, we can move on to the next one. Does levodopa help with tremor specifically, or more helpful with rigidity or slowness, and have less of an impact on tremors?
So that's the thing I definitely get this question a lot as well. So with levodopa is most effective for slowness, rigidity, stiffness, and for tremor, it may or may not help with tremor, right? It finds that tremor can be more resistant to medication, and people may find that when they take their levodopa carbidopa, as if the medication isn't doing anything. In some cases, people will possibly try to increase or think that increasing their dose of levocarb might help treat their tremor, but then we have to think about possibly worsening their dyskinesia and increasing side effects. With Parkinson's disease, often people will find it's a unilateral tremor, right? So it's like a tremor either in your non-dominant hand or your dominant. And generally they find that with the tremor, hopefully it'll go away with movement, but it'll come back when you're resting, right? When it's held in one position, like when you're holding a spoon or a fork to eat. So it's more, of course, the resting tremor. So often the tremor can be a very big nuisance, but hopefully not a source of causing, disability, right? So usually when this comes up, depending, I would honestly talk to your neurologist, movement disorder specialist, so they can see how you've been responding to the levodopa, and just seeing if there are some medications that you could possibly try to help manage your tremor, right? But then it really does depend possibly on your age, right? Because some of the side effects, like for example, the medication can cause drowsiness, confusion, right? We don't want to affect we don't want to cause cognitive impairment, right? So but to answer your question about levodopa, it may or may not help with tremor, right? And it just really, if your tremor is really severe and disabling, if it really affects your quality of life, definitely bring it up with your neurologist and see what maybe the best way to proceed is.
Okay, thank you. We have a question here. When taking levodopa, should people be drinking a big glass of water with it?
I think it doesn't hurt, to be honest, to take it with water. Like, it helps, like, swallow your tablet. You can take it. Yeah, I honestly, when I take medications, I think water helps it ensure that it's going down through the esophagus and into the stomach and not, getting stuck, right? So I don't think that's a bad idea at all.
Okay, and we have a question here. What to do if it seems that fatigue as a side effect of levodopa is outweighing the benefits?
So in regards to fatigue, right, it's one of those things where you have to make sure, like, is it any other medications? Like when someone comes in and tells me that they're experiencing fatigue, I will always go through their regimen. I'll ask them, how are they sleeping? Right? Like, how are you sleeping? Are you finding that you're waking up in the middle of the night? For some of my men, I'll have to ask, like, I'll have to take a look at their medications. Do they have, an enlarged prostate that causes them to get up throughout the night to urinate, right? Are they waking up in the middle of the night due to their Parkinsons and having difficulty rearranging themselves, moving their bed sheets and readjusting, right? Because if you're waking up in the middle of the night due to that, those are the things I would have to look into. Just so I would always start with sleep. I would start with other medications. I would take like a thorough background. If you are sleeping and you're still waking up fatigued, right? Or, there could be so many different reasons. I would definitely, honestly, in this case, refer to your neurologist, because they might want to possibly start you on a medication to help provide you with some alertness, so that you don't find that some people have told me with their fatigue, they feel like, they might take an afternoon nap, and in the early, they're falling asleep at night a little bit earlier than they used to, and they can get, a solid 8 to 9 hours of sleep, because just the moment their head hits the pillow, like, it's just the fatigue. It's just, there's so many different factors. It's such a complex issue, but generally, like I said, I would have to go through, as a pharmacist, right? I would see if I can go through their medication, see if there's something that we can possibly adjust. I'll take a look at if any of the medications they're taking is causing sleepiness, and just honestly, just a thorough kind of background information, just seeing what their day-to-day life, how they're sleeping. Like, it's just a lot of information gathering. But after my information gathering, sometimes it is having to refer to a doctor, because obviously the levodopa has a role in helping you do the things that you need to do. But obviously, if you are finding that fatigue is an issue, it may not be possibly due to the medication. It might be due to the Parkinson's disease itself, right? So it's best to talk to a neurologist about that. Does that help answer the question? Just because it is so complex.
It is very complex, and I think you did a really good job of explaining it, so thank you. Okay, we have a question here. Someone is taking 1.5 pills immediate release every 2.5 hours for the first part of the day, and then 1 immediate release after, but at times they're noticing that their dystonia is creeping in anyway. Do you have any advice for that?
First part, and let me see, sorry. Present dose is 1.5 tablets immediate release every 2.5 hours for first part of the day. So can I ask, like, is this going to be like early afternoon? But then after that, they have, like, later in the afternoon, for example, at 2 p.m., they have to take the first part of the day, then 1 immediate release after. Sorry, can you just clarify for that question? So so this is my understanding, okay, when I read this question. This individual is taking 1.5 tablets every 2.5 hours, right? For the first part of the day. Are we saying that might be until 2 o'clock? And then I'm just unsure of the 1 IR tablet after. When are you taking, when are you taking the 1 IR after? At times dystonia creeps in anyway. I think in that case, are you taking any other medications? See, when I see something like that, I would have to take a look at the whole regimen, right? If someone is also maybe taking controlled release, are they taking a dopamine agonist? How are they sleeping? Because it might be either adjusting their medication or it might be adding something to their medication. Because with dystonia, right, sometimes people will get dystonia early in the morning, right? When possibly, the level of medication is the lowest, right? It's because often sometimes with dystonia, someone might take like a controlled release formulation at night only, or some people might be taking a dopamine agonist at night. So this one definitely for me would be a complex question, and I definitely would refer to a neurologist for that, because in this case, adjustments might need to be made or something might need to be changed or added to the regimen.
Okay, thank you. We have another question about interactions here, and I apologize if I pronounce this incorrectly, but do you know of an interaction between pantoprazole, which is taken for GERD?
There shouldn't be an interaction. I'm just actually trying to get access onto my drug interaction software right now. I'm just having a little, if I close this window, can you see that I'm minimizing my window by any chance?
No, there are no changes on our end.
Okay, perfect. So I'm just going to actually go through this right now. And if we can just go through the next question while I set this up, that's totally fine, if that's okay with you.
Sure, yeah. There's another question here about vitamin D. Does vitamin D slow the progression of Parkinson's disease? And if so, how does it work?
I think I haven't seen of anything just recently of anything slowing the progression of Parkinson's disease down. Can I ask, where did you find this information? I know sometimes, I think recently, even in my inbox, I've had articles, talking about, the latest research, but from my experience, I haven't seen anything of Parkinson's disease and calcium. But again, I can see if I can confirm that right now. Let me just take a look here. Have you read anything? Sorry, did PSBC send out any publications recently about vitamin D and Parkinson's?
No, I don't believe so. I haven't seen anything recently about vitamin D and slowing the progression.
Yeah, I haven't personally come across anything either. I'm just going through my chapter here, just through my therapeutic resource about vitamin D, and nothing is coming up on my end for that one.
Okay, thank you. And that person who asked the question has replied. They said they found it from the internet, that information about vitamin D and slowing the progression.
What I'm actually doing as we go through this is I'm actually keeping down just a list of things that I would like to look into. So I'll definitely look into this, and I'll definitely report back to PSBC if that's okay. Just to see if I can find anything about it, because I'd actually be interested to read up on that.
Yeah, absolutely. And if you can share that with us, maybe we'll find a way to post it on our website or something like that as an additional resource to this webinar.
Sounds good. And just to answer your question, I'm looking at levodopa and pantoprazole right now, and just through my drug interaction resource, I couldn't see any drug interaction between the two, but of course, confirm with your pharmacy as well. But on my side, I don't see anything. And then for the vitamin B12, with levodopa, I'm not seeing any interaction either, but of course, confirm with your pharmacist and just where you're dispensing your medication.
Okay. Yeah. Thank you so much for doing that. That's really helpful. Okay, we have a question here. Someone's doctor has said that they cannot take dopamine agonists forever. Why not?
I think with the dopamine agonist, I think a lot of it is the side effect profile. I'm unsure why the doctor might have said that, because maybe there's something about your patient medical history, your background. But I remember reading up in a resource, let me just pull it up here, that right here, I just wrote down that with the dopamine agonist, they should be used with caution for those over the age of 70. And I think it's just because of more side effects can increase with age, right? So it's just concerns about possible hallucinations, psychosis, which are more common with the dopamine agonist. And for some too, it's just with the side effects, they might be more particularly prone to occur in elderly and maybe possibly even those cognitively impaired, right? So it's just definitely the side effects can be concerning. That's why your doctor may have said that, but I'm not quite sure. But that would be my guess.
Okay, thank you. So we have a question about entacapone. It is only available as 200 milligrams, and it looks like this person has added this to their levodopa carbidopa regimen. Their entacapone prescription was 200 milligrams 5 times a day, but the tablet is not meant to be cut in half. But the dose of entacapone was too strong for this person, and it led to some negative side effects. Do you have any experience advising patients on how to gradually reduce the dosage of entacapone? And can too high of a dosage result in a person getting too much levodopa?
So to answer that question, that's the thing with entacapone. Entacapone, essentially, its role is to help prolong a dose of levodopa, right? So it helps prevent it from being metabolized or broken down in the periphery before it gets to the brain. So I'm just trying to find, it's one of those things where when people are started on levodopa and entacapone, their levodopa dose actually might need to be adjusted to account for the possible increased side effects of now getting too much levodopa. I'm just trying to find my notes here. I actually wrote something about that, right? So, because of the combination and how entacapone works of prolonging, levodopa and increasing possible doses of increasing the levels of levodopa, decreasing the levodopa may be required, especially if you're experiencing side effects. And that is definitely often something done by the neurologist. So it's definitely something that you would want to speak to them about. Because in some cases too, I remember speaking to someone about this, about the thing about entacapone is when it is being added, your levodopa has to be monitored because some adjustments may need to be made. So it would be a dose reduction, maybe just an overall kind of just change in your levodopa dose so you don't have that experience. I personally haven't had any experiencing advising patients on how to reduce the levodopa, but often it would be the change in levodopa that would have to be done in this case, and not so much the entacapone from what I've read.
Okay, thanks for your answer on that. That was really helpful. And I'm just looking at the time here. We are running close to the end of the session. So I know we did get a lot of questions today. So maybe the questions that we don't get answered, we'll be sure to keep note of them, and hopefully Amy can help us answer some of those questions that we don't get to today. And we can certainly look into doing a session similar to this one again in the future if folks find that this is really helpful.
Yeah, I think that would be a really great idea because I can definitely see some questions here. So if it's possible, yeah, if you can send your letters or your questions rather to PSBC and just ask, like, this is what I like to be answered, so that next time I can just answer them right off the bat, because I think they're great. Like some of these questions, I think that they're great, and I think a lot of individuals might have the same question, because I think some of the questions that we've answered today hopefully has helped many of you. They were good questions, and I know it can be tricky with what's available out there, right? So I would love, and even now when I'm looking at all the notes that I took for this presentations, there's so many things that, didn't come up as well regarding, for example, possible constipation, and just other medications in general. Some people asking about IR and CR and taking both. So please, I think it'd be great if you guys can send in your questions, and I would love to do another one sometime in the future.
Yeah, we would love that. And just looking at the chat here, it looks like some folks would really enjoy that as well. So if it's okay, I think we can answer one more question before we wrap up today.
Okay, I think here. I think the next one after that was, is there any issues taking levocarb and CBD oil? Is it recommended to help sleep? Honestly, from my experience, I don't have any experience with CBD oil. I would have to refer you to a specialist that has experience with that. Can I ask PSBC, do you guys have any resources on CBD? I think when I was looking at your educational events, I think you guys had maybe some speakers in the past that might be able to, I don't know if they have like a publication or anything that might address this question.
Yeah, we don't have anything specific on CBD, but we do have a help sheet on cannabis in general. And then earlier this month, actually, we did a webinar on cannabis as well.
Oh, perfect.
Yeah, so I can pull up that link and then I'll send it here in the chat. But otherwise, it looks like we are just running out of time today. I just want to thank everyone for taking the time to log on to this webinar this afternoon. I hope that you found it to be very helpful. And I just want to say thank you to Amy as well for your time being here with us today and for answering questions from the community. It was really helpful. Thank you so much.
Thank you so much to PSBC, to you guys, and just thank you for everyone that attended today. I hope it was helpful, and please do send your questions just our way, because I think another Q&A definitely seems needed at this point, so I'll be glad to do it.